Hi, my name is Olatokunbo Akinde, and this is a video presentation of the pharmacological treatment for the disease of depression. The pharmacological treatment of depression may include a combination of both the use of medication and psychotherapy, and the goal here is to achieve the most effective and most efficient treatment plan for the patient in question. And it has been said that a combination of the use of both medication and psychotherapy has been associated with the increased quality of life of patients when they adhere strictly to the treatment plan as prescribed by the prescriber. The medications for depression is usually prescribed for a duration of 2 to 12 weeks, depending on if the client is adequately consistent with the use of the medication as prescribed by the prescriber. However, before a prescriber actually prescribes a medication for the disease of depression, the prescriber has to take into consideration certain things before they prescribe any particular medication, and this includes the patient's health history and the history of previous treatment. The reason why the patient's health history has to be taken into consideration is because the patient might be hypertensive or diabetics and might be using medications for this, and so the prescriber has to know what kind of medication the patient is currently using, so as not to prescribe a medication that would react negatively with what the patient is already using. So this is very important that the prescriber takes into consideration the patient's health history, and also the prescriber has to take into consideration the fact that the patient might actually have gone through the use of medication for depression, and in this instance the prescriber has to know what kind of medication the patient has used or what kind of therapy that the patient has used before. The prescriber must also take into consideration the side effects of the medication he or she is prescribing. This also has a relation to do with if the patient has used a form of antidepressant medication before, and if such medication has had any kind of side effect on the patient. So the prescriber has to have full knowledge of this in order to be able to prescribe any other form of medication for the patient in question. And the prescriber must also, before prescribing, have a knowledge of the safety and tolerability of the medication he or she is prescribing to the patient. Another thing that is very important is the familiarity of the patient to the physician. This in some cases helps to encourage the patient to use the medication that the prescriber has prescribed for he or she, and this is because if the patient is familiar with the physician, it's kind of like stimulates and encourages the patient to want to use the medication that is prescribed by such physician. In most cases, it has been said that the failure of the medication to work is because patients do not adhere strictly to how the prescriber told them to use the medication. There's non-compliance on the part of the patient, and then also sometimes the inadequate use of the dosage if they do not use it as prescribed by the prescriber, and also the inadequate use of the therapy that the prescriber has used will also cause the medication not to work. In situations where we have patients that has been diagnosed with major depressive disorder, the American Psychiatric Association, which is the APA, in 2011 recommended that each individual client should be taken as an individual person, that the symptoms that each client is showing should be used to come up with a treatment plan for that client, that there should not be a general kind of treatment plan for all patients that has been diagnosed of depression, that each client should be seen as an individual person, and each client, their symptoms that they show should be unique to such individual clients. And in such a case, to come up with a treatment plan, the APA came up with the fact that the prescriber should there should be a clinical assessment of the patient in question. when you're talking about clinical assessment, that means the symptoms that the patient is showing should be looked into. They should look, okay, what kind of symptoms is this patient showing? There should be a do we have any presence of other disorders? Is the patient showing any, aside from depression, is the patient showing any kind of other depression, like anxiety, nervousness? Are they involved in the use of substance abuse and stuff like that? The prescriber or the physician should have knowledge of this. Also, are there any other stressors that can be causing the patient to fall into a depressive mood? Is the patient going through difficulty at work, or is it a school situation? This has to be taken into consideration, because these stressors might actually be the issue where the patient is falling into a depressive mood. So in this kind of situation, the use of medication might not actually be effective if the source of the stress is not actually is not looked into, and is not looked into to help to reduce the depression that the patient is going through. Also, does the patient have any kind of preference? This goes to the fact that, was the patient treated for depression before and is using any kind of medication for depression, or has used any kind of medication for depression? If this is the case, the physician or the prescriber has to have knowledge of this, and in order to come up with a kind of treatment plan for the patient in question. Also, does as the patient reacted to any other kind of treatment? Is there any kind of reactions that he or she has had to any kind of treatment, like any kind of medication or any kind of psychotherapy treatment that has been used for the patients? Drugs used for depression, we have the SSRIs, we have the SNRIs, we have the atypical antidepressants, we have the SEAMs, we have the tricycline antidepressants, and we have the St. John's wort. The St. John's wort is kind of different from the other kind of drugs that I've mentioned earlier, and this is because it's a herbal remedy to use for depression. This is a medication that has been used in Europe, and it's been very popular in Europe, and it's just been newly introduced to the United States, although there has not been any kind of efficacy to how it actually works, but it's been used, and it's been recommended that if it's been used within 3 to 6 weeks and there's no clinical kind of improvements, then other sorts of medication should be sought. The SSRIs are like the greatly preferred class of medications to use for depression, especially in children and adolescents, and also in late onset diagnosis of depression. The SSRIs, however, have some adverse effects on people, like you have the gastrointestinal upset, it has sexual dysfunction, and it reduces energy in people. It makes them tired and restless. And aside from these major side effects that the SSRIs have had, it's actually been very prominent in treating depression, and because of these little side effects, and that is why it's actually been used by people, prescribers, to treat depression in people. Examples of SSRIs are, we have the Celexa, we have the Prozac, we have the Lufox, we have the Praxil, and we have the Zoloft. And aside from using medication to treat depression, we have psychotherapy to treat depression. As examples of the psychotherapy that we have the behavioral activation, we have the cognitive therapy, we have interpersonal activity, and we have the problem solving therapy. In most cases, the cognitive therapy has been cognitive therapy has been seen to be very effective in helping to solve the problem of depression. This is because clients that fall into depressive mood often exhibit negative thoughts about themselves, about the world, about everything that concerns them. So cognitive therapy aids to encourage positive thinking. It helps them to create activities which encourages them to think positively and about whatever they're doing, about their life, about people that they're associated is associating with, instead of thinking like, oh, this person is here to harm me. Cognitive therapy tries to make them see the other version of life, try to make them see how this person, rather than coming to harm you, is here to help you to deal with certain things that you're going through. So, and in the case of behavioral therapy, activation, here it's a form of CBT that helps it helps to monitor activities and activity scheduling to increase the engagement of a patient in activities that will help them to increase their mode of living. So it's kind of very close to cognitive therapy, but it's different. And there's also the problem solving therapy. The problem solving therapy helps them to actually solve problems in little beats. It helps them to improve their quality of life and their problem solving skills as well, and it helps them to decrease the distress and improve their way of life. As a social worker, my duty is to help my clients, and in helping my clients, I help them to cope with the challenges that come with having depression and falling into depressive modes. In this case, I would identify the strengths and the weakness that my client has. His weakness might be in terms of using the medication that is prescribed. It might be in terms of going for therapy. So my job or my role as a social worker is to encourage my clients. And aside from encouraging my clients to follow up with the therapy and the use of the medication, I also follow up with him to ensure that he complies with the uses of this therapy and also of the medication that it's being prescribed to him. And in following up, I get to know if the medication has any kind of adverse effect on my clients, and if my client needs to have any kind of medication change or any kind of if the therapy that is involved with is not helping him to solve the depression that he is in. So my duty is to help to follow up with this and to help to advocate for change if he needs to be changed. And in doing all this, I also evaluate the services that has been recommended to him by his prescribers or his physicians, as the case may be. And thank you so much for listening to my video. Bye.